Hello, my name is Melissa Anderson. I work in the UMass Medical School Psychiatry Department as a hearing psychologist. I'm also involved in the Deaf Yes Center for Deaf Empowerment and Recovery.
Hello, I am Wyatte Hall. I work here at UMass with Melissa, and I am deaf myself. I just graduated from Gallaudet University's Clinical Psychology PhD program, and I just moved here to Massachusetts.
We are thrilled to help celebrate May is Mental Health Awareness Month. This year's theme is Advocacy and Empowerment. So I'm curious about your experiences. Have you ever experienced a situation where an attempt to advocate goes wrong?
Unfortunately, attempting to advocate may be one of the most common negative experiences. Culturally sensitive deaf services that are deaf-centered are very rare. Most of the time, people are just unaware. They do not create barriers intentionally. I can think of one strong example like this. A deaf person was experiencing an acute psychiatric emergency and admitted to the emergency room. The ER staff, including doctors and nurses, were all discussing his case. They were discussing what to do with his case, whether he should be admitted or what kind of medication he may need. There was no interpreter or attempts to communicate with the deaf patient. He had no input on his case or involvement with the medical people taking care of him. When the discussion was over, treatment went ahead while the deaf patient just followed along.
So even though those doctors and nurses, they weren't bad people, they were just unaware of the need to include that person and his decisions in their care, right?
That's right. The patients are an expert on themselves. They know their own life experiences. They can give important information about themselves. It can be easy to set up access through a sign language interpreter. Usually, your first thought when you see a deaf patient is making sure an interpreter is provided. You can also write back and forth if the deaf person prefers that. There are many different ways you can work with a deaf person to figure communication out. But the priority needs to be figuring out communication so that deaf person can be included in their own treatment, not just for deaf people, but hearing people too. But it especially needs to be considered with deaf people. Sometimes the ER is stressful. It can be tempting to take the easy way out and forget to take time for communication. You have to remember to slow down, make time for communication, and interact respectfully with the deaf person.
So you mean the first step for advocacy needs to be thinking about communication access?
Yes, the patients need to be able to communicate with the medical people responsible for their care.
So what happens if a deaf person comes to us and doesn't have a lot of experience advocating for themselves? How do we support them to advocate for themselves?
Well, that depends. If a patient comes to see one of us, we can help them with skills development for advocacy. The deaf community is very collective, sharing their experiences with each other to help them learn that way. But the number one thing is you need to know your rights. You have the right to have access to your care and to strongly stand up for that right.
So the right to make decisions about their care.
That's right.
Cool. Thank you.
Thank you.